I'm Dr. Wayne Larrabee, a facial plastic surgeon from Seattle.
And I'm Dr. Susan Kurian.
We'd like to talk to you about both a very new and a very old subject, which is regenerative medicine. We've always known how important being holistic is in healthcare, both aesthetics and general welfare. But we really have realized more recently that in order to get a really good aesthetic result, you have to have good general health. And regenerative medicine is quite important. Specifically, we started working on hormone replacement therapy. It's interesting, there are a few myths about that really, I kind of knew it, but I've really researched it recently. They're both so important. One is that most of us, or many of us anyway, thought that there was a risk of prostate cancer from testosterone or breast cancer from estrogen. And when you look into that data, it's all based on false data with synthetic hormones, Premarin, for example. If you use bioidentical hormones, there really is no risk. And I've really looked into this lately, and it's just absolutely true. There's no risk of prostate cancer or breast cancer by using increased doses of bioidentical hormones. So that's important. The second concept, which is kind of intuitive, but you have to think about it to really understand it, at least for me, normal values, quote unquote normal, are basically based on a bell-shaped curve of lab results, and those are based on people who are frequently older or sicker and so forth. And so if you really want to be quote unquote normal when normal is that normal, or do you want to be optimal when your hormones are at their optimal for your health and your healing and your brain and your heart? And I think most of us want to be optimal. And there's no increased risk for having your hormones optimal, why not, kind of thing. So that's what we're thinking. So we started a hormone replacement therapy program here at the Larrabee Center, and Susan, Dr. Kieran's going to be involved in it, obviously. So do you have any thoughts about that?
Absolutely. So, as a daughter of a breast cancer doctor, this was something that was very important to me to make sure that there was a good scientific basis for what we're doing. But I think that I've gotten tired of hearing again and again from patients, especially women going through menopause, that something has just changed in their overall health. Their brain doesn't work quite the same as it used to, and especially their skin, and their kind of the way that their skin works and moves, and the texture of it is completely different afterwards. So I think as facial plastic surgeons, this is a huge factor in what we do. And if we can really optimize this, we can optimize everything else that we're doing. So I'm a big fan.
Well said, Dr. Kieran. So the program's up and running now. We've got a very organized program with labs and everything organized very nicely for you. So if you're interested, just give us a call. Thank you.